morning and thank you for joining us. Teresa is not here for the YouTube session. I will now share our daily case counts. We have a total of 16,293 cases, an increase of 38 cases from yesterday. Of the 38 new cases, 12 are close contacts of confirmed cases, 10 are community acquired, and 16 cases are still being investigated. 352 cases are active, and out of these, 159 cases are of variants of concerns. Unfortunately, we're reporting 2 additional deaths from yesterday, 424 deaths overall. A woman in her 50s from the community passed away, and a man in his 60s from the community passed away. My thoughts and prayers are with the community, with the family who lost their loved ones. At present, we have 15 cases that are hospitalized, 1 is in the ICU, and there are currently 9 active outbreaks in Windsor-Essex. 8 are in workplaces, and 1 is a community outbreak. With respect to vaccines, we have now distributed a total of 216,954 Windsor-Essex residents have received at least 1 dose of the vaccine, which takes us to 49.5% coverage rate overall from all the age groups. And in between those, 199,856 Windsor-Essex residents have received only 1 dose, and 17,098 residents have received both doses. So switching gears now, talk about the Victoria Day long weekend. This weekend is the Victoria Day long weekend. We all have been through a lot this past year. We are missing our loved ones, friends, and many of the things that are part of our normal everyday lives. This weekend, take time to relax and recharge. With the success of the vaccine rollout in Ontario and in Windsor-Essex, yesterday the province announced that on Saturday, May 22nd, outdoor recreational amenities will reopen, including golf courses, sports fields, and skate parks. As well, outdoor social gatherings are increased to a maximum of 5%. Remember that indoor gathering with anyone outside of your household is strictly prohibited. COVID-19 and variants of concerns remain a considerable threat to our community well-being. We have already seen how quickly our case counts can go from 16 to 70 in just 1 day. It is important that everyone remembers to maintain good public health practices while enjoying and engaging in any activities outside of your home, regardless of the vaccination status. Please always maintain at least 2 meters of physical distancing from others that are not part of your household. Wear a mask in public setting, and where 2 meters distance cannot be maintained. Wash your hands regularly or sanitize with alcohol-based hand sanitizer. Avoid touching your face and eyes with unwashed hands. Do not go out if you are not feeling well, and get tested and isolate if you have symptoms of COVID-19. We must continue to follow these public health guidelines. It is through the continued adherence to these practices and continued increase in vaccination status of our residents that we can start to look towards a future that looks more familiar. As reported this long weekend, Victoria Day weekend, our offices will be closed on the upcoming Monday. However, the vaccinations are continuing on their regular schedule, and there are no changes in existing appointment for this vacation, for the vaccinations. I'll now move on to our epi summary. Okay, so looking at the numbers in Ontario and our daily new cases and 7-day average, we can see the numbers in the province are declining. And similarly, when we are looking at our Windsor-Essex data, we started to see a decline in the cases, and right now we are plateauing. We're still reporting daily cases which are in the average 30 to 40 cases a day, with some blips in between. Last week we reported our highest case counts of 70, and clearly showing that the variants of concerns can change things very quickly with respect to number of cases, and continued adherence is important. So putting that picture in perspective, both Windsor-Essex and the Provincial data, we can see that it's overall on the decline, but we still need to be mindful of how variants of concerns can change the day and the need to stick to some of these measures. Looking at our week-over-week case rates, This slide captures the week-over-case incidence rate per 100,000 population and just shows the full completed week. Our most recent completed week rate is 67.6%. My apologies, 67.6%. 6 cases per 100,000 population, and this has increased slightly. And looking at just the past 7 days, our rate is 65.1 cases per 100,000 population. Comparing our case rates with Ontario and with the Southwestern Ontario, we can see our case rates were relatively lower than the province of Ontario, but now our case rates are similar to what we are noticing with the rest of the region in the Southwestern Ontario. Looking at our wastewater surveillance data, comparing our data from last week. In the past week, our numbers have declined, but has shown a little bit of decline, but now it's back to where showing some elevated signals with respect to the SARS-CoV-2 virus in our wastewater data, highlighting that there are active cases in our community, and that's continuing to show in the wastewater system. Right now it's aligning well with what we are seeing with our daily case rate. So something that we need to be mindful of, that there are cases in the community and there are cases of variants in our community, and we all need to continue to take precautions when we are out and about. Looking at our person positivity data, in total we have done 345,152 tests overall as of May 15. And in the last week, up until May 15, our person positivity was 5.2%, and this has remained unchanged from the last week. Last week, approximately, we conducted 4,909 tests were completed last week. Looking at our person positivity data, just on the last 7 days, where we are with the rest of the province, and we can see that some regions have really high person positivity rate, while our region continues to have a person positivity at 5.3%, and almost close to the middle of the pack with respect to the person positivity data, which is definitely a good sign. But as I mentioned earlier, we still have active cases, quite a few of them, and with ongoing signals from the wastewater data. Highlights the importance of keeping our guards and ensuring that we are following the public health measures. Breaking the person positivity data by age group, a similar picture, what we are seeing is another increase in the younger population between 0 to 17. The person positivity is increasing, while the rest of the population group continues to show the same person positivity in all these other age bands. Breaking further down the younger population, 0 to 17, into different categories, and we can see that while the number is slightly increased in each of these age bands, all the way from 4 to 8 and 9 to 13 and 14 to 17. So some increase in all of these age band, and a lot of these cases are coming in from their family and maybe some other activities outside of their household. Putting all this into perspective with respect to age epi curve by age, and we can see that there has been some increase in the last week with cases in the school-age children, and now it's plateauing in the last few days. And this graph basically just put the comparison of our overall community picture and the 7-day average comparison with the school, with a slight increase in the last week or so. Our overall cumulative regional and provincial rates are presented in this graph, which is basically showing that our Windsor-Essex is now at the number 4th with respect to our overall regional and provincial rates. Looking at our, breaking it down further into where these cases are coming from, especially from May up until now, majority of our case rates are coming from Windsor, followed by the town of Essex, and then LaSalle and rest of the municipalities. With respect to the proportion of these cases starting all the way from April 19th to May 18th, that means the last 30 days, the bulk of our cases are coming from Windsor, 71%, and followed by Lakeshore, 7%, which we have seen some increase in the last weeks, and then followed by Tecumseh, Essex, and the rest of the municipalities. Just focusing on the last 7 days, majority of our cases are coming from the city of Windsor, 3/4 of our cases, and the rest of the municipalities are also listed there. From an age and sex distribution, no change from the last 2 weeks worth of data that we were presenting, but as we can see, almost or 50% of our cases are from 0 to 30 years of age, 0 to 29 years of age. And if you recall, we just opened the vaccination eligibility for this group recently. So we're hoping that with a high coverage rate in that age group, we should see a decline overall in that age band as well, and overall case decrease in our community. So it's really important for individuals in these younger age group that if they haven't received the vaccine yet, please book your appointment and get your vaccine as soon as possible. From an exposure perspective, we continue to see ongoing community transmission with cases coming from the community ranging all the way from 30 to 40% on any given day, which is a concern and signifies the importance that in the community there is ongoing transmission and the importance of following public health measures. This just basically sums it all up. 36%, 37% of our cases are coming from community, while the other major proportion, more than 50%, are coming from household or close contacts, and the others are from other sources. Variants of concerns continues to be an issue in Windsor-Essex, with cases, more and more cases reported every day here with variants of concerns. And if we are looking at from a percentage perspective, almost 50 to 60%, and even some days as high as 90% of the cases are attributed to the variants of concern. Please note that the last few days there may be some lag in data reporting, but overall we can see in the last week 70 to 80% of the cases are from the variants of concern. And that is one of the reasons that we continue to caution that things can change very quickly, and the virus can spread very quickly because of these variants. Hospitalization data, we continue to see a decline overall trend in Ontario and in Windsor-Essex. Similar picture in the COVID-19 cases in the ICU. An overall decline in the province as well as locally. Those people who died as a result of COVID-19, we can see that 95-96% of these cases are in the elderly population, 60 to 60 plus population. And from a case fatality perspective, our case fatality rate overall is slightly higher than the province, but lower in the long-term care home and higher in the community case fatality rate. Looking at our day-over-day doubling time, our data was pretty consistent with the day-over-day doubling time higher than the provincial average, the province and Canada. But now our lines are coming closer to each other, and with our numbers dipping slightly, which is something that points to the fact that there is ongoing transmission happening in the community. Our median R not effective is right now is at 1.01, and this is slightly fluctuating overall in the last few weeks. And as we have reported, if we are seeing an R naught of more than 1, that means every case is generating more cases than before, meaning that the case will continue to increase in our community. If the R naught is less than 1, that means we are seeing a decline in the cases, and we should continue, if we follow in that trajectory, we should continue to see less and less cases every day. So right now we are fluctuating around 1, which is why our case rates have been steady in the past few weeks. So now talking about COVID-19 vaccination status. So this is just a graph that basically compares where we are in the world with respect to the share of people who have received at least 1 dose of COVID-19 vaccine, and I just put some selected countries. There are other countries that may have better data than what I'm presenting here. So one of the leading country in the world with respect to the vaccination is Israel, with more than 60% of the vaccination vaccinated. And then among other countries, UK, which has seen one of the severe impact on hospitalization and deaths with respect to COVID and their vaccination rate. And as you can see, Canada started late with respect to vaccination, but now has surpassed the vaccination coverage than the United States, while the rest of the other countries in the Europe are still falling behind with respect to vaccine coverage rate. So we are in a much better position, and with more and more vaccine coming in, we should continue to vaccinate our population at that rate, and that will be helpful. So now comparing that data from our Windsor-Essex data, that this is where we are with vaccination coming closer to almost 220,000 population with at least one dose, and this is a significant achievement in Windsor-Essex. So looking at our number of vaccine doses administered daily, so we are now administering approximately 4,000 doses a day. And there are days when we have administered as high as 4,700 doses a day. So it's the vaccine supply. If it stays consistent, we can continue to ramp up the vaccination and continue to vaccinate our people using all our channels, including the mass vaccination site, our primary care providers, and our pharmacy network. Just showing a little bit more with clarity that we're administering roughly around 3,600 daily doses to our residents, and based on a 7-day average. From a vaccine coverage by age perspective, our 60-plus population that are covered with at least one dose is 85.5%, which is really good. And our overall coverage based on the time when this data was compiled was 48.3%. And we see the gradient effect with the higher vaccination rate in older population and lower vaccination rate in younger population, and partly because of the time that these vaccines are available to each of these age groups. You can imagine that 80 plus had the most chance to stay eligible to receive the vaccine. But we are hoping to see that in each of these age bands, we should see at least 70% coverage in each of these age bands to feel really good about our vaccination coverage in Windsor-Essex. From an uptake perspective, this basically just shows where we are in each of these age bands and what kind of response we are getting. So in this graph, we can see the older age groups such as 80s, 70s, and 60s, we are starting to see that the curve is bending. That means the demand is decreasing in that age group, while some of the other lines that we can see in the younger population, the demand is ongoing and people are booking the appointment and getting the vaccine. And we like all of these lines to merge in the end in the 70 plus range with all of these age bands. So looking at our coverage in the hotspot areas, our hotspot coverage right now is 45.3%, while the overall coverage is 48.3%. So we are not too far off, but clearly there is a variation in each of these hotspots, while N9Y continues to have the highest vaccination rate, despite being the hotspot, which is great. But some of the other hotspots, such as N9A, N9C, and 8X, there is more opportunity for us to increase the vaccination rate. Working through our community partners under the hotspot strategy, we hope to have more targeted approach in these communities to increase the vaccination rate. So this graph basically looks at where these doses are administered, and while we can see that the majority of the doses have been administered in the hospital-based clinics, since they were in operation for much before any of the other clinics started, followed by the public health-based clinics, the mass vaccination clinics, and then the pharmacy, who has helped us to distribute a lot of these vaccines out in the community. So again, just breaking it down further with respect to how the proportion of these vaccines that are distributed. And as we can see, we're using all the channels to distribute the vaccine, which is really good in increasing access of vaccine to our residents, and also using all these network to expedite the delivery of the vaccine. So which is really a great thing, great partnership with all our health care partners, including our hospitals, our pharmacies, our primary care providers, and our municipalities, our local leadership really helped us in distributing all these vaccines in our community. So based on the type of the vaccine, our workhorse vaccine continues to be Pfizer-BioNTech, which constitute most of the vaccine that's still distributed in Windsor-Essex, followed by AstraZeneca, and then followed by Moderna. So another way to look at from a proportion perspective, 68% Pfizer, and then 16% Moderna and AstraZeneca as well. Another way to look at it based on the breakdown, so we have seen a huge uptake of AstraZeneca in the in early March and all the way up until the time when AstraZeneca first doses, we stopped giving out AstraZeneca first doses. So this graph basically just shows a picture of how the vaccination rates, high vaccination rate, and the impact on the more severe outcomes such as death in Windsor-Essex. So as we see that when the vaccination rate increased, the deaths in the community has dropped significantly, and it's unfortunate that we still reported 2 deaths today, and identifying the importance of getting the vaccine as soon as possible and get yourself protected and others protected. So in summary, our case rates have been fluctuating in the past 2 weeks, and our acquisition source continues to be our close contact and community transmission. Overall, from a health system capacity perspective, our hospitalization and ICU have decreased not only in the province but also locally. Our wastewater surveillance data remains unchanged, signaling that there are still ongoing cases in the community, and that's resulting in transmission and continuing to keep our case rates at the level where we are stuck at anywhere between 30 and 40 cases a day. Our overall vaccination coverage rate in all the age group is 48.3%. And then with respect to the summary monitoring indicators, our most recent completed weekly case rate is 67.6 cases per 100,000 population, while as the most recent 7-day is a slight decrease, 65.1 cases per 100,000 population. Our percent positivity remained unchanged. Our most recent percent positivity is 5.3%, which is, again, it's not much different. And our R0 is at 1.01. It's still showing that our cases are staying at the same level instead of declining, and we'd like to see the R0 going down to less than 1. Thank you.
We'll now take questions from the media. AM 800.
Dr. Before we get into the presentation, just want to get your thoughts on the new 3-step approach by the province.
I think it's a cautious approach, and it is important that we need to open up to things that are less risky from a spread perspective. This variant of concern is really challenging to deal with, and it really spreads quickly. And we have noticed that in our local community as well, that our cases changed rapidly in 1 to 2 days. So I think a phased approach is better, and ensuring that it allows everyone to get the vaccine as well. We are still, as you know, our vaccination rate is pretty high in the adult population, but starting May 31st, we'll be targeting our children to get the vaccine, 12 plus to get the vaccine, and that would really help us. So I think it's not a bad idea to have this phased approach to ensure that we're not opening up too early only to close after. I think the variant of concern and the effectiveness of these vaccines are really, really critical in ensuring that we stay open and we continue to stay open. No one wants another closure, trust me. I think it is really important that we all do that. Our businesses, each one of them, have suffered locally as well as provincially. So I feel for them, and I want them to continue to stay open once we have that level of vaccination and lower transmission. So as a community, I think we have to do our part. We have done with respect to following the public health measures. Now also to make sure that we are getting the vaccine and we are keeping everyone protected. We want to keep our economy going. We want to keep our businesses thriving in the region, and the phased approach, I think it would really help everyone rather than rushing things forward only to close after.
With the phased approach, I know you mentioned this to us yesterday, how you weren't a part of the conversation of this plan, but just looking at it here, obviously different percentages for each stage. Let's say we don't reach those percentages for these stages. Does that mean for the vaccine, does that mean we stay where we're at?
A good question, Rob. I honestly, I don't know. I think that it has to be a combination of everything. And as I said, right now, the transmission is ongoing. We know that every community may react differently to like the rates cannot be the same. So even in the age group, we have noticed that in the 80 plus population, our coverage rate is 93% and our 94% coverage rate. We cannot expect that would be the case in each of these age band. So overall, cumulatively, what the picture looks like for the community may be different. So I don't think that can be applied consistently, but we hope that would give the motivation for everyone in the community to get vaccinated. And but I doubt that there will be like a hard stop in those numbers or percentage of vaccinated or vaccine coverage in the community.
And finally, with the staged approach, when you looked at it, anything catch you off guard? Like you mentioned, you weren't a part of the discussion. I'm guessing you were briefed on it afterwards, but anything catch you off guard or anything out of the ordinary that you weren't expecting or were expecting?
Not really. I think the only thing that I was expecting that there may be some talk about the school reopening, which I think there was still no clear answer on the school reopening. I was expecting that maybe there will be talk, but I think it would be helpful for our community because we want to open up vaccination for 12 plus starting May 31st. And that would give us a time to vaccinate the kids before they go back to in-person learning. So we would really try to use that opportunity to give the kids the vaccine before they go back to even like for a week or two back in-person classes.
Thank you.
CTV?
I know the press conference regarding AstraZeneca was pushed back to 10:15, so we're waiting on that. But I know there's word that they are going to allow those who receive the first dose of AstraZeneca to get their second dose of the same vaccine. Are we ready for that locally? Do we have enough supply?
So good question, Stephanie. We have been working with the ministry for the last few days on that strategy, looking at our number. And most importantly, the key question is what's the schedule looks like for the second dose, because we first gave out our vaccine. I think the first day was March 17 or March 19, and that timeline. So that gives us right now 8 to 9 weeks or 9 weeks approximately since the first dose for the people who got their first shot. So we'll have to look at the duration interval, what the province finally lands with their recommendation. We know from a product monograph perspective, the duration between first and second dose interval is between 4 to 12 weeks. And we also know that based on the way this vaccine works, 12 weeks has been shown to be the most effective. So if we want to shorten it, what does it mean? Like, are we saying 10 weeks is a better one, 9 weeks is a better one, 8 weeks is a better one? So I think we just have to be really careful about what the direction is before we finalize our plan. But we are ready as much as we can with respect to the vaccine availability, with respect to reaching out to our primary care, to our pharmacies who gave out the first vaccine, and we'll be good to go when the provincial announcement comes in.
I know that some people I spoke with who have received AstraZeneca, they're very eager to get the same dose because those are the studies obviously have been done with the same vaccine. But I know that these vaccines are supposed to, the ones we have are supposed to expire at the end of the month. So like you were saying, you guys have to consider whether it's worth going earlier than the 12 weeks. But a lot of people don't want to wait and experiment on a different vaccine. And some of these residents feel like they deserve a say in it. What message do you have for those people?
Yeah, no, absolutely. And I think as part of any engagement, we do want to provide them with the best available evidence. And mind you, like the people that I've talked to, they're all interested in getting their second dose to finish out the series, and without being in the situation where they want to mix and match. So I am anticipating that there will be many more people who would want to get the second dose, recognizing that the risk is significantly lower for the second dose for the thrombotic event that everyone is concerned about. So we want to give all that option to our community, and we want to make sure that people who have received who rolled up their sleeves to get the first shot available with AstraZeneca. I think just want to thank them, because they are the one who basically drove our vaccination coverage rate significantly high in our community, and we want to make sure that they can finish their dose full series based on the vaccine, based on this by getting the same vaccine, and just complete the series. So we definitely want to give them that opportunity.
So would it be like appointment only, like for the people obviously that received the shot in March, they would be the first ones offered the second dose of AstraZeneca, and then we move down in age brackets again? Is that how it would work?
The key determination would be the dosing interval. So that's what I would assume that we'll talk about. So for example, anyone who's received 8 weeks before, let's say I'm using just this 8 week as an example. So 8 weeks before anyone who received the vaccine, they will be asked to book the appointment with the pharmacy that they've received their initial vaccine, and we'll be working with the pharmacies to make sure that they start giving them the timeline. They're booking them appropriately to give out the second dose. So it would be based on the interval rather than the age band.
Okay, just moving on, I know the ministry is reopening beaches. We're moving into the long weekend. What are your thoughts about that?
So I think as the temperatures are getting better, the weather is getting nicer, there will be more people who will be outdoors, and we know the outdoor is safer than the indoor environment, and people would want to go outdoor. I would just caution them with respect to congregating with other families or other people, and because we are truly concerned about the ongoing transmission in the community. And while we still have ongoing transmission, we have to be careful. I think that's my only message. I want people to enjoy the outdoors, but I also want them to do it safely and with their own family members.
Okay, thank you.
CVC?
Good morning. My question's regarding the reopening plan. Previous lockdowns have had a dramatic effect on our case counts, but I think it's fair to say this time around, the case rates haven't really gotten down to where you'd want to see them. Are you concerned at all, despite our high vaccination rates, about starting to loosen things again when the case rates are still high?
Well, I think it's a fine balance, and it's really tough from a policy perspective. We recognize that there has been, call it whatever, a COVID fatigue or whatever. It's been more than a year that people are following these guidelines. So there are some things that we truly understand that's important from a health perspective, but we are also understanding some of the mental health impacts, some of the economic impacts on all these people. So it's just finding the right balance. I think using that phased approach with gradual reopening, it would ensure that by the time we get to each of these stages, our vaccination rate is really high, and it will also allow us to bring the weekly case rates down everywhere, not only in Windsor-Essex, but in the province. So I think overall, we have to open up. I think it's just a matter of how do you open it up safely and at what time. And there is, I think this is an approach which really tries to find the right balance of without putting anyone at an increased risk.
fair to say also that, you know, in this region, we pay a lot of attention to American news and what's happening south of the border. With the loosening of restrictions on mask wearing and other initiatives in the U.S., are you worried that people might subconsciously or consciously, you know, adopt, you know, the policy that's happening in the States right now, which is significantly looser than our local restrictions?
Short answer, yes, I do worry about that. And I can, when I'm talking to people, when I'm listening to what they're saying, they are picking up some of this messaging, and I think it's wrong. We are a completely different country. What we have experienced with COVID is completely different. United States by far has been one of the countries that has seen most of the devastation with COVID-19, with large number of people dying and millions and millions of getting infected. Canada has done a pretty good job in terms of having that severe impact of COVID in the country. I know when we are just talking about Canada, we all have our concerns about, you know, could we have done better? Yes, absolutely. But when we are comparing ourselves with some of the other countries, we have done a pretty good job in containing COVID-19 pandemic. So when people are picking up on some of those messaging, it's one of those concerns that, in my opinion, has led to increased cases in US. So we definitely don't want to be in the same boat, only to find out that how we got back to the same position where these variants has mutated up to a point that it has become a concern. So we want to make sure that people in our community recognize that Canada and USA are two different countries, two different philosophies, two different type of people and their behavior. It cannot be the same. We have to follow what we are doing, and we have to follow our Canadian recommendations, which is important for the safety and well-being of our community.
Thank you.
Blackburn?
Yes, good morning. Just in regards to the deaths that were announced today, do you know if the cases involved there?
So you broke down at the end, but I'm guessing you asked if these the cases who died were they a variant of concern?
Yes, that's what I asked.
Yeah, both these cases were a variant case.
Okay, and just in regards to the reopening plan, do you expect the second phase with the 20% for second doses? We've been pretty far off from that. Do you, based on our current vaccination rates, do you have any kind of estimate as to when we might reach that?
So getting to the 40% coverage, it would take us some time, because 40% of our population roughly is approximately, like I would say, 180, 190,000 people. And giving out 180 to 190,000 people, even with 5,000 doses a day, it will take us at least close to 40 to 50 days before we can be there. So I don't know. We'll really have to see what the vaccine projection and vaccine supply looks like, and I don't know what will be the time when we will be at that level. But as I said, I think we'll have to look at those numbers. We'll have to make sure that it aligns well with what the reality of the vaccine supply and the rate of vaccine distribution.
Thank you.
Windsor Star?
Yes, good morning, Doctor. Did you say that anyone aged 12 and older will be eligible starting May 31st?
They will be eligible to book and receive the vaccine. So that's what the ministry announcement was, and we are working in the background to make it available for all the 12 plus individuals to receive the vaccine starting May 31st.
Okay. For the most part, mass vaccination clinics, it looks like you're booking appointments 6 to 8 days out now. How is demand holding up?
I think it's been pretty good. We appreciate the demand because it really helps to fill our clinics, vaccination clinic, and it just gives us a higher coverage rate. So we are very pleased with that, and we are encouraging everyone to book their appointment as quickly as possible. And if we need to open up more days for vaccination, we will. But so far, I think it's been pretty good, and we want to keep it that way.
And separately, at the Board of Health meeting yesterday, it spoke about the reintroduction of fluoride into drinking water. Can you reiterate what the timeline is for that?
So there has been some delay in terms of some of the studies that NWIN wanted to do to ensure that the reintroduction of fluoride would not impact the ongoing lead control program that's been implemented in the city of Windsor. Because of some of the delays with respect to closure, travel restriction, and whatnot, they're hoping that they will finish all these studies, and November 2021, they should be able to add fluoride back into the water.
And I know you've said this before, but can you reiterate why the reintroduction of fluoride is being done?
Well, our oral health has been declining in our community, and it continues to decline. The longer we delay, the oral health of our children is declining everywhere in Windsor-Essex. So with the reintroduction of fluoride, we know that it would help improve the oral health of our community, and it's one of the intervention that's been identified as an important public health intervention at a population level from an oral health perspective. So we're really hoping that it can be reintroduced back into the water to protect the oral health of our children.
CFTV. Additional questions from AM 800?
Oh, sorry, the feed cut off there for a second. I'm good. Thank you very much. Have a good weekend.
CTV.
Just your thoughts again on the reopening, considering step one is at 60% of people vaccinated. We are at 60%, but obviously we're doing a province-wide approach. It's very frustrating on a lot of residents here in Windsor-Essex who feel like we've done our part thus far. So your thoughts on not taking a regional approach again?
Well, as I said, that everyone in our community, and especially our businesses, have suffered a lot throughout this pandemic, so I can feel their pain. The numbers or the parameters that's been used, obviously, it is a provincial number, and we have already crossed that 60% mark, but we still have our cases. I think that's where I would go back to, not only about the vaccination, but when our case rates are still at 40 cases or more on an average every day, it does pose that risk. So we want to take that opportunity with all these extended measures to bring that case counts really down and continue to vaccinate. The more people that are vaccinated, the better we will be. So I'm hoping truly that we will open up safely without having to worry about closing it down again. So I understand their pain, I understand their frustration, and hopefully we'll be in a better spot in the coming weeks.
Thank you.
CBC.
Yes, it looks like this weekend we'll pass the threshold of 50% of our entire population having at least one vaccine dose. Dr. Ahmed, do you have any reflections on that, what the significance is, and also wondering how you think vaccinating the other half of the population will go?
Yeah, no, so just a quick thought that really excited to see that benchmark cross, and we'll be really, really happy knowing that, you know, at one point Canada was way behind in receiving the vaccine, and then things changed. We started to receive vaccine quickly, And with our strong partnership locally with all our health system, our hospital, our primary care providers, our pharmacies, our partnership with the municipalities, it really helped us to expedite the vaccine rollout very, very quickly in our community. So it's really a great achievement for all of us. And I'd like to see that continue with more and more people vaccinated in our community to even get to a better spot, not only with just 50%, but 70% is something that I have always thought in my mind. If 70% of our population overall is vaccinated, that's the minimum number that we need to feel much safer in our community. And but mind you, we still have our second doses to give, and we can only do it with our ongoing partnership and ongoing support from our community.
Thank you very much.
Blackburn?
I'm good.
Windsor Star?
Yes, Doctor. Sorry, the feed cut out when I was asking questions last time around. I didn't abandon you. I just also wanted to touch on from yesterday. Teresa had mentioned that 2 sites have been chosen for community consultation about safe consumption sites. Can you give us any information about that process?
Unfortunately, I didn't look at some of the notes this morning, so I can't share, but maybe we can try to answer this question either next time or maybe through internally with our team. But all I can say is that process needs to happen to make sure that people are aware about these sites, and it's part of the normal process for any of these CTS site application that goes in. We need the community support, we need the municipality support, and obviously we need the public health support. Since public health is leading that, so obviously we are in support of that, but we also need support from the municipality as well as the community.
Okay, thank you.
CFTV?
Yes, good morning, Dr. Amick. I have a quick question for you about vaccinating children. Will this COVID-19 vaccination be mandatory for all students to attend school or register school or school as other vaccinations are in order to get into the school?
A great question. At this point, no. Right now, it's voluntary, and people will be students and families will have a choice to receive the vaccine. But we don't know about the future. There are other vaccines that are under the Immunization of School People's Act, ISPA. COVID-19 vaccine is not in that list, so right now it's voluntary, but we strongly encourage everyone to get the vaccine, especially the younger ones, so that they can go back to learning in person, which is the most effective way to train and teach our young minds.
Do you anticipate that this will be a vaccine that will be on that list at some point?
I don't know for sure, but at this time it's not included. There has been some discussion whether it should be part of that, but again, those are just the discussion. There is no decision or there is no inclination that it would eventually happen.
Okay, thank you. And also, when these vaccines start becoming available to children that are 12 and under, I'm talking about just hotspot areas because I am in a hotspot, and I was wondering if children under the age of 12 at that point will be able to get a vaccine as well if they're in the same family.
So under the age of 12, we don't have any scientific data on that population yet. So we don't know how the younger than 12 population vaccination looks like. So we'll have to wait and see. But if you have all the older 12 years and older children and adults vaccinated, the risk to these younger ones will be really low. But I can't share, I don't have the answer at this time that, when and how the 12 and younger vaccination would look like.
Okay, but they will be available. I'm assuming it will open up for everybody in a hotspot kind of at the same time, like your 12 to 16-year-olds If you're in a hotspot, you'll all be able to get the vaccine at the same time, correct?
Yes, that is correct.
Do I
Yeah. So,
understand that correctly?
yeah.
All right.
Yeah.
Thank you very much. No further questions.